While we were living through the pandemic and trying to continue the design for the new tower, our leadership had the foresight to ask the question, how would we design this building differently if we were designing it to future-proof it for the next pandemic? So it was really important that we almost take a pause and look at what our current frontline workers were dealing with.
When the pause happened, we were just finishing schematic design, so we had a pretty good understanding of what building systems we were going to need, what the building size and shape was going to be, what kind of program was going to go in it. And when the pandemic hit, it kind of all went on pause.
As part of this, we did kind of a literature review, and we reached out to other peer academic medical center institutions to see how are they responding to the pandemic as well. So there's a lot of information out there and conflicting ideas to go through. So it was really came down to, we don't want to over-design things for the future. So what are those small things that we can do that can make a big difference without, blowing this project completely out of budget and out of schedule.
We were kind of experiencing and listening and hearing things from all of our healthcare clients during this. So we knew, some of the things we were going to have to address, right? Surge capacity was one of those big ones that we knew we were going to have to address that. Another one was air separation, right? In the facilities. We knew we were going to have to address that.
We worked within the entire BJC system to gather data. So we sent out a survey to all of the facilities within the BJC healthcare system to really understand how the different facilities all were reacting to the pandemic. We wanted to see if there was anything at various different facilities of how they were able to adapt and overcome that maybe BJH wasn't doing a little bit differently. And then once we kind of had that information, we created a task force within BJH specifically for this project. And we included in that everyone from the facilities team to infection prevention. We had doctors who specialize in infectious diseases, nurses who are working on the front lines, everyone from EVS and housekeeping to even food and nutrition, talking about how do we clean the rooms and turn them over, how do we deliver food to infectious patients. So it was really a wide breadth of people that we wanted to get input from and their understanding of how things needed to change in the future.
The main redesign component on the HVAC side was the inclusion of the exhaust air box, which actually allows us to control specifically how much air is going into the room and how much air is going out. By putting a box in every room, we're able to control each room individually, or entire groups of rooms, or half a floor, entire floor, or the entire tower if deemed necessary.
So we focused our changes to the patient room on really two areas. The first being meeting the code minimums in our typical acute care patient room to actually be able to house an ICU patient. So that meant several things within the patient room itself. One, having larger clearances around the bed itself to be able to bring in more mobile equipment that's often needed for patients. And then some more minor changes that people might not even notice to the head wall of some extra emergency power and some extra med gases so we could accommodate more patients who are on ventilators, things like that. A couple of the other changes we made were more focused on the staff themselves, and during the pandemic, every time a staff member enters a patient room, they need to completely don into PPE. They go into the room, fully gowned up with all their protective gear, and then when they come back out of the room, they have to take that all off. So that's a big process. And so one of the simple things that we did was just providing a window in the door of every patient room so that the nursing staff has the ability to have eyes on the patient without actually entering the room.
With every decision that we make during the design process, we do like to understand what the cost impact will be, but also what the schedule impact would be. And of course, with everything that we sort of developed out of our brainstorming sessions, there was a cost associated with it.
We were to bring schedulers into the process to understand the schedule impact of some of these items or some of these options, estimating resources to understand the cost of these, and builders, right, from out in the field to really understand, how to make these solutions constructible.
I think everyone going in was thinking that this would end up being something with huge mechanical and MEP impacts in terms of negative pressure in the rooms. But we did find solutions that were actual minor changes to some of standards that BJC already has for their patient rooms that were not huge changes, but in terms of taking care of the patients, could make it easier for the staff and provide more of that flexibility for the future.
Some things that we've done here are, I think are going to be here, and we're going to do these things like common practice going forward. It's like a lot of things that we've learned coming out of the pandemic are things that make sense, right? Like you're going to travel less now because you realize you can do Zoom calls. You're going to design our facilities to be able to do some of the things that we're doing here just because you can, and it makes sense, and it's safer and it's better.